Welcome to our Bulletproofing Your Low Back webinar tonight. And I know there'll be some of you watching the recordings, so we're going to just bring up the PowerPoint right now. We're going to jump right in. And let me just get the slideshow going. And here we go. So tonight, this topic, Bulletproofing Your Low Back. I find that there are two types of people that seem to want to get this information. It's either the people that have a little bit of back pain now and then, and they just want to get a handle on it so that they can prevent any problems in the future. And then there are people that are struggling with chronic, ongoing low back pain, and they're concerned because it's really affecting their life in a big way. So I want to make sure that I'm addressing both of those crowds today. And I'm going to be giving you a little bit of the details here on even some research, that what research shows us. It actually tells us that 1 in 3 Americans right this minute have low back pain. 1 in 3. So think of all the people you know, 1 in 3 of them is struggling right now with low back pain. So it is, and it affects actually the broad scope. So I'll notice that, there'll be the younger population that, they tweaked their back, they did something, they had an injury or something like that. And then as they are aging, getting into their 30s, now they're maybe in a sedentary lifestyle with a job at a computer or working remote or that kind of thing, and then they're tweaking their back. It's a little bit easier to tweak their back than it was before. And then as they're getting a little bit older, now they're starting to throw their back out now and then. And after a while, their back is going out more than they're going out. So it starts to affect them more and more. They're reducing and narrowing their life to live around it. So they don't do the same things they did in the past, just learning how to accommodate it. And then after a while, people just say, oh, I'm just aging. It's just aging. And they just learn to live with it. So that's certainly not the way we see it. When we talk about bulletproofing your lower back, it doesn't mean that you never will injure your back in your life. What it means is that if you do, that you're going to recover quickly and you're going to resolve it and get back to living your life fully. So that's what we mean by bulletproofing your low back. And so that's our topic for tonight. And so now I want to talk about this idea that when you go to seek care for your back, it actually makes a difference. It's important on who you see on your very first episode. The research shows that people that go to a medical doctor on their first incidence of back pain, 20% of those folks are going to end up with surgery. The people that go to a chiropractor as their very first visit for low back pain, only 5% end up with surgery. And when I look at my own stats and my own practice, I've only had about 4 people over 40 years that have had to go for surgery. And fair enough, I think there was maybe one of them that I was the first person they saw, but all the rest had already seen the medical doctor before and were coming to me and kind of almost as the last resort. And we did a lot of good work with them, but they still ended up going for surgery. So, but when you think of the stats with that, for me, that's less than 1% of my practice. So over the 40 years. So I've got some pretty good results that I get with people. And so I want to share with you exactly what I do find and how we address it. How do people get such good results here in our practice? So how does it present? What am I seeing when people come in? I'm seeing people that come in, they've got, of course, the low back pain is a concern. They've got tight muscles. They've lost ranges of motion. They're feeling stiffness. And some people are feeling the pain starting to go down into their leg. Sometimes it goes all the way down into the calf and even into the foot. A lot of times it's kind of around the buttocks area or into the thigh. Sometimes there'll be some swelling in the area, or they'll feel some burning, maybe even some numbness. Some people are feeling the burning or numbness even down in their feet with like a neuropathy kind of thing. So that's kind of how it presents. But it really does cross the board on who it shows up with. So, for example, I have a fellow I'm thinking of, his name is Jeff. He's a contractor. So he's working, he's what I would call an occupational athlete, someone that's working with his body all day long and year after year, day after day. And he actually had some trauma to his low back. And with care, he was able to recover from that trauma and get right back on the job. But then I also have this woman, Donna. She's a busy mom. I'll tell you what, busy moms sometimes I would consider them occupational athletes as well, with having to pick up their kids all the time and then go and play with the kids and then pick up the house and everything like that. But not only that, she was also a teacher. And so her back pain was affecting how she was able to be a mom and also even in her work. And again, she had a different type of low back pain than the fellow that was a contractor. But again, we figured out exactly what was going on for her, and we were able to help her. I've had athletes in the practice, crazy bicyclists that are just so demanding on their lower spine. And then I have the executives that are the desk jockeys that are sitting for 60 hours a week and then trying to be a weekend warrior on the hockey rink, going out like a maniac on the weekends. So it really does cross the board. And the thing that's most disturbing to me is I'm seeing it in younger and younger populations. So I'm actually seeing kids showing up with complaining of back pain, and kids and folks in their late teens, early 20s, they're just embarking on their life as an adult and they are struggling with back pain. So it really disturbs me when I see that, because certainly 40 years ago when I first started practice, I just didn't see it that much in the younger folks, but I am seeing it now. And so we really have to do something about it because this next generation is in trouble. So what happens? It's widespread. It affects every age, male and female. But the most important thing is it really derails life. It derails fun and fitness and productivity and sleep and energy and life across the board. So in all of these cases, it's preventable. And that, again, is another thing that really bothers me when I see it show up. Like, this could be completely preventable. And especially when I see it in a chronic situation, it's almost totally preventable and it's absolutely correctable. But to correct the problem, you have to understand what the cause is. And so that's really where I want to spend some time today, is really understanding what the cause of low back pain is, so that you can figure out what is the appropriate way forward and what it's going to take to get you back on track. So we're going to go through a little bit of an anatomy lesson. And this is going to help you to take better care and make smarter decisions for you. So let's just take a look at this suit of armor that is protecting your spinal cord and your nervous system, and show what the research tells us about the best strategy to bulletproof your low back. First off, we are looking at the pelvis and the sacrum, and then the two lumbar vertebrae that sit on top of the sacrum. And of course, the rest of the spine is just going to travel right up through stacked up, all the joints stacked up, all the vertebrae stacked up right up on top of the lumbar spine. And so this is the base, the foundation of the spine. And I oftentimes find that this sacroiliac joint, which is the most complex joint in the body here on either side of the sacrum with the ilium or the pelvis, the sacroiliac are one of the main causes that I see in my practice.
Are you trying to show us a visual? Because I'm seeing your face.
Oh dear. Then thank you for telling me that.
Your face is lovely, but I think there's a picture you want to show
Yes,
us.
there is. There totally is. Okay. Thank you for telling me. I'm not sure why that happens. So let me just come out of here and I'm going to share my screen and see if we can come back to that. Thank you. All right. Well, just need to find where here we go. That's not it. Hang on. All right, let's try that again. Yeah, whenever they do updates. Let's see. I found it. Okay. All right, let's try that again here with our slideshow. There we go. That's the picture right there. So I had just already gone through how it presents in the office, what I see. And then this is the anatomy lesson here. So we're looking, let me just see here. I want to just move this so it's not blocking. Let's try that down there. Okay, so we can see the sacroiliac joints on either side. Here's the sacrum in the middle. The ilium are the two wings of the pelvis that you can see on either side. So this joint right here, the sacroiliac joint, it's one of the most complex joints in the body. And then above the sacrum is where the lumbar spine stacks up, and the vertebrae just go right up from there in a tower. So this joint, as I said, it's the most complex joint, and it's where the whole weight of the torso is sitting on top of the sacrum there. But I would say that more than 50% of the people that come into my office complaining of low back pain actually have a sacroiliac concern. And when we take an X-ray, the sacroiliac problem, it's a functional problem. It's how that joint is moving. So it's not necessarily something that's going to show up on an X-ray as a structural thing. And that's why it oftentimes gets missed. There are lots of ligaments that crisscross this joint on the front and the back. And that's what makes it so complex. So there's a very particular way that I help to stabilize the sacroiliac. And it works so well when we can really nail it with people. They notice the difference sometimes immediately. And then there's a whole protocol of recommendations of how to take care of your spine and your pelvis with the activities of daily living if you do have a sacroiliac instability that we go over as well. But when the sacroiliac is unstable, what happens is it's the foundation of the spine. It's almost like if the foundation that you're standing on was getting unsteady, then everything above it starts to grip, trying to manage some degree of stability because the stability has been lost in the foundation. And that means you'll get spasming up in the lumbar spine and the musculature. And it's not uncommon that as these joints go awry, their complexity is so important for our balance and the movement for the whole rest of our body. But it's not uncommon people will start to complain of knee problems and foot problems and shoulder problems and jaw problems because of the instability in the sacroiliac and how crucial it is for everything else to be in a flowing state. So that's the sacrum and the pelvic anatomy. Let's now take a look at the lumbar spine anatomy. And so here we can see the lumbar spine where it lives. The sacrum is at the very bottom. The 5 lumbar vertebrae are right on top of that, and they are very big bones. And those bones that go up the spine in the thoracic and up into the tiny cervical bones are different. And that's because these lumbar vertebrae are supporting the entire weight of the body. So they have to be nice big bones to support that. In between the bones, we see the discs. And the purpose of the disc is to be a spacer, not a cushion, not a shock absorber, but a spacer to make sure this hole is the right size. So this nerve that comes through here, this has room to breathe to carry the messages as it goes into the lower parts of the body, down into the legs and into the innervating the organs of the intestines, the bladder, the reproductive organs, and so on are all innervated from these nerves that come out from between these bones. And then we see the spinous processes coming off the back of the spine. Those are the bumps that you can feel going down your back. And then these joints right here, we call the facet joints. And this is where movement happens. I've got another image I'm going to show you in a minute, but these facet joints, these can get irritated as well. Let's see, here it is. So let's talk a little bit more about the disc, and then I'll tell you about the facets. So when we look at the discs here, this disc is in between the bones here. Now this disc, it does not get a lot of blood supply. So there's got to be a way that the body can get fluids and nutrients in and get toxins out. And so the way the disc works, it's called imbibition, and it's like a sponge. So if you squeeze a sponge, you squeeze the water out, and when you release it, it sucks the water in. That's how a disc gets its nutrients and gets toxins out, is by movement. Movement that squeezes or twists or moves the disc around. And so movement of the body, movement of the spine is crucial to keep the disc healthy. And it's called imbibition. Now, sometimes the disc gets unhealthy. And when it gets unhealthy, it can start to break down. Now, there can be a sudden trauma that can put a lot of impact down on the disc. I had someone just come in today who was lifting a piano and they were just, may have been lifting it improperly. Whatever happened is they compressed a disc in that moment. So it can happen in a moment like that. But it can also be something that's wear and tear over time. And that's the situation where somebody's like, I was just picking up my keys or my bending over to brush my teeth, my toothbrush, and suddenly they experience pain that is then related to a disc herniation. So if we look closely at the anatomy of the disc, it's a jelly-like inside, the nucleus pulposus, and then we have these annular fibers that surround it, and the annular fibers keep the jelly on the inside. And that jelly is important because it keeps mobility in that disc. It gives it some structure and some mobility. And so two things can happen when there's a disc herniation, and there's different degrees of disc herniation. So there can be just a bulging that is happening, and then there can be literally the disc material oozes all the way out and even can break off and just float around in the joint. So there can be ruptured discs that happen as well, and sequestered discs and all kinds of things like that. But there can also be just a bulging of these fibers. And there's a few different ways that this can play out. So one way is it can have a trauma that literally just tears the annular fibers and the disc comes out just from so much of a trauma. But it can also be a wear and tear situation where the fibers just get weakened over time. And then when they start to break down, then you have that disc material coming out. But there's one other way that this can happen as well. And I'm going to just shift to this picture so I can explain it a little bit more. The nucleus pulposus in the middle here is the jelly-like substance, annulus fibrosus. And you can see these are layers of fibers. You can see all the different layers of fibers. And if you notice, they go at a diagonal, and one layer is at a diagonal. The next layer next to it is the opposite diagonal. And then the next one's the opposite. So they're crisscrossing. The annular fibers are crisscrossing layer after layer after layer. And they did a study at the Bethesda Hospital, Maritime Hospital, I believe it is, in Bethesda, Maryland, where they worked with cadavers. And what they found is you can have the annular fibrosis, the fibers can separate. And if they separate, that nucleus material can bulge out and can come through. But if you twist the spine back and forth, you can actually get those fibers to come back together and have the nucleus, if you have a little bit of traction and elongation that pulls the vertebrae apart, it can suck the disc back in and those fibers can join back together. So there are some folks that they'll come in, they'll have a disc herniation, and within just a short period of time, that disc gets sucked back in and the fibers get back into place and they recover rather quickly. Although the tissue itself is still going to take time to heal, they have a fast recovery. On the other hand, if these fibers are broken down and they literally are torn and the disc material herniates through, in that situation, it takes a while because two things have to happen. One is we have to see if we can still suck that disc material back in, but we don't have the fibers supporting it as well so that it has that quick improvement. So it takes longer. But the other thing that happens is when that disc is protruding and it's hanging out there where it's not supposed to be, the body recognizes that. And that smart body of yours actually will send the immune system in to just start to eat away at and dissolve the part of the disc that is herniated out. And that just takes time as well, but it's still your smart body's way of taking the pressure off the system and just getting rid of the part that is in a place where it doesn't belong. So it's pretty amazing what the body can do if you give it the time that it needs and the correction that it needs. This is a little bit of a better look at the facet joints and how they can get inflamed. So the facet joints, they are overlapping. And so when you rotate your lumbar spine, when you twist your lumbar spine, or when you bend forward, they slide back and forth a little bit to give you that movement. But those facet joints, those also they can be in a healthy state where they have good fluid and lubrication and movement, or they can get inflamed and they can get deterioration and degenerative changes over time as well. Again, and that's because of stress on that joint. That's not aging. That's only going to be the result of uncorrected trauma or misalignments to the spine. So we call that facet joint syndrome. So these are all things that can contribute to low back pain. And you can have any one of these, or you could have all of them at the same time. And that has happened as well. And so that's a much more complex case. But we just need to identify what's really happening inside in order to then provide the correct correction so that that person has the healing that they need in order to get back to their life. All right, so sometimes people will get sciatica. Sciatica is when they have pain going down into their legs. And true sciatica is where it actually goes all the way into the calf. That would be true sciatica. Many people will get pain referring down into the thigh. Technically, that's not called sciatica, but it is a referred pain, and it does go along the sciatic nerve. But anyway, I get it when people show up and they're holding onto their hip and they say, it's my sciatica. Like, I get it. We don't need to know what the name of it is. We just need to know what the cause is, and we need to correct the cause of that. But you can see that coming out of the sacrum, there are these, out of the lumbar spine and the sacrum, we have the nerve roots coming out. And those nerve roots, as they come out, they join together. Once they exit the spine, they join together and form a big bundle that's called the sciatic nerve. And that sciatic nerve goes down the leg and then has branches that come off of it to go to the different parts of the leg that it's innervating, the muscles and the blood vessels and the tissues and so on. So that's the big sciatic nerve you can see right here. And so sometimes you can even have spasming of the muscles. Remember, we talked about the sacroiliac instability that you can have. And as a result of that instability, the muscles spasm up. Sometimes the piriformis muscles on a spasm right across that sciatic nerve. That can also cause referred pain down into the leg. Sometimes the psoas muscle is on the front of comes across the front of the pelvis, and that can put some pressure on that area as well. So we're always looking at all those different aspects to understand what could be causing sciatic nerve irritation, which then leads to the pain, the numbness, the tingling into the buttocks, the legs, and the feet, and so on. And here's a picture of an x-ray. X-rays are really useful to get a sense of what's happening in the spine, in the lumbar spine. And so I want to just orient you a little bit here. So we can see a beautiful lumbar curve, a healthy normal here. We have those nice big blocks of vertebrae. We have good sized discs in between them, and we have a beautiful curve. And remember, the curve is the give in the spine. That's the spring in the spine, and that's what allows your lumbar spine to be able to bear all that weight that's coming on top of it. Is it has a spring in it. So your shock absorber is the curve of the spine. The discs are not shock absorbers. They're terrible shock absorbers. They get all worn out if you just pound down on them. And so we have to have the curve, and that curve actually is the spring that protects the discs so the discs can continue to do their job of being a spacer. Now, when we look at this abnormal spine here, we have two views. We have an X-ray and we have an MRI. So here on the X-ray, instead of having this beautiful forward curve here, we can see the line of the curve is actually straighter. So if you look at the edges of the vertebrae, remember right behind that red line is where the spinal cord and the nerve roots are coming down the spine. And so you can see this is flush and straight. You know, it's a continuous line. And right here, this one is forward more. And this one is a little forward more. And then we have it coming down onto the sacrum. Now, what you also may notice is here, the discs are a bit, this is a nice big disc right here. This one's getting narrower. This one's quite narrow here. And this one's quite deteriorated down here. And you can even see some bone spurring happening through here. So the bone spurs, again, these points right here, those are all things that take a long time to occur. And they are the result of degenerative change that's from the misalignment. The loss of the proper biomechanics in the spine is what leads to this wear and tear. If we look at an MRI where we see not just the bones, we can see the spinal cord where it comes down, and we can see the discs here. You can see the discs are white here. It means that they have a certain density to them. These discs are black and they're bulging out. So they're unhealthy discs. They haven't had the proper nutrition over time. And so we can see the big herniation happening right through here. And then this is kind of looking at a slice of the middle of the spine. And so here, this is looking at the whole thing, not a slice. So we can see where the nerve roots are, where they would come through these holes. We don't see those holes here because it's looking at a slice in the middle of the spine. But needless to say, that this bulging disc is going to start putting pressure on the nerve roots that are coming right across there and are trying to exit from the spine to carry the vital messages down into the legs and into the organs. So you can see that there's a loss of the curve here. There's the bulging of the discs, and there's the roughening of the edges of the vertebrae, which tell us, and the spurs that you can see here, which are the indicators of degenerative change. So it might be, the phrase might be a slipped disc or a disc herniation. Discs don't really slip because they're attached on the top and the bottom. They're actually attached to the vertebrae. So a slipped disc really is referring to a herniated disc or a bulging disc or a ruptured disc. So when we have these symptoms, they are body signals. And they're signals that your body's trying to get your attention to tell you that you're moving away from health right now. And so what is the conservative approach, or not the conservative, the conventional approach to all of this, is to just try to not feel it. Just try to not feel it. And we're going to look at what the common allopathic options and approaches are to trying to manage all of this. And we're also going to look at some alternatives to that. So the allopathic options, they look something like this, where, just get some bed rest, just rest up. And certainly if you've had a trauma, a day or two of bed rest may be useful to just get a little bit of the gravitational stress off of that area. But ultimately, bed rest is not going to be the best approach because it just causes all the muscles to atrophy and weaken, and you're not really moving. So the disc is going to be getting going to be getting the nutrients that it needs because it's not getting the movement. So it's a good way to try to live around it, but it's not going to be the best approach for healing it up. And so we want to look at, well, what are the best approaches? And let me just pop ahead here for a moment. And yeah, so before we go into all of these approaches, drugs is the very most common way of people dealing with this. And I just want to take a look with you at what the research tells us about people that are using drugs as their approach. So how bad has it gotten? Well, 80% of Americans are going to experience back pain, and a third of the people at any given time are struggling with back pain. And it's actually, back pain is more common in females. About a third of females suffer, but of the men that suffer, 31% of the men report that it actually affects their work, while only 20% of females complain that it affects their work. So they just tough it out, right? But 50% of women experience back pain when they're pregnant. So, just early on in life, they already start to have an experience of that. And half of the people that experience back pain are desk workers. So it's much more the sitting that is the problem, rather than what you may think of as, the people that are out there working hard and working with their back. It's actually not as common as it is in people that are sitting too much. And so there is a deficiency of movement that is actually part of the problem here. The direct cost of all of this low back pain in our culture, it's one of the number one causes of healthcare demand, and $50 billion is spent in the direct costs for low back pain, and $100 billion in the indirect costs. The indirect costs are like people that are, not performing at their highest level, but they're still showing up to work. So we don't call it absenteeism, we call it presenteeism, where they're there, but they're not actually being productive. So there's all kinds of indirect costs as well. And, let's recognize that when somebody in the family, especially if it's the breadwinner that is struggling with back pain, maybe they can't work, that starts to affect everybody else in the family as well. So the life effect, it's a real story of how it affects people on every level, affecting their finances, their productivity, their jobs, their relationships. They're irritable, they're upset, they're anxious about where is this going to go, when am I going to get better? And then people just start to live around the problem. They just stop doing the things that they love, and they start to just get into a downward spiral where they're afraid to be active. And then it contributes to that downward spiral. So, and it can get much worse than that, because with that real pain and suffering, that leads to chronic issues, and, they want relief. And so oftentimes they start with NSAIDs, they start with Tylenol or ibuprofen or an over-the-counter, and then that's not taking care of it. And so the next thing they do is they go to get a prescription, and then they start to get, higher and higher levels of prescriptions because they stop working after a while. And then they start to get into the opioids. And this is the real problem here, the opioid use, and how habitual that can be, how it can be addictive. And then they recognize that it's addictive, so then they cut people off from it, but they still are having the pain and they're still addicted to it. So the next thing you know, those folks that were getting it through a prescription, they're out on the streets getting it through heroin, and they start to go down that road, and their lives are destroyed when they go into that realm. So it leads to drug use, that then actually destroys families, it destroys lives. And actually, when they go out on the street, the heroin, which is in the opioid family, it's actually 1/10 the cost of what it is to be paying it through the prescription drugs many times. So it's a big problem. And I even had a colleague who hired a chiropractic assistant who ended up overdosing on opioids. She died. Yeah, he hired her, and within a few weeks, she didn't show up for work, and she was dead because she had an overdose of the opioids. I had a cousin who, she had chronic low back pain, and she used to use these morphine patches. And the idea is that you use the patch, and when it's all used up, you take it off and you put another one on in a different place. And that was how she managed that back pain. And one day she forgot to take one of them off and put another one on. And her daughter found her dead in the bed because she had overdosed on the morphine. So opioid addiction is a real problem. And oftentimes it starts with people that are just trying to manage chronic back pain. So it's such a real concern when people tell me that they have chronic back pain, because I know how bad it actually can get. So we have a health crisis, and our nation's biggest health issue right now actually is low back pain. And if we look at, and the opioid crisis is part of that picture. So, and here in Vermont, we are leading the other states in the amount of opioid addictions that there are. This is just a slide that shows that over time, from 1993 to 2005, 2016, the opioid uses, and it has the different types of drugs that were being used, but even the fentanyl, starts to show up there in bigger and bigger amounts. And this is 2016, so this is already a long time ago, and it's only continued to escalate. This is the opioid prescriptions per 100 people in each state. And so at this point in time, this is in 2012. Right now, Vermont actually is much higher than it was back then. But look at this. This is astounding. When I looked closely at what this data was telling us, it blew my mind. So if you look at this, it tells us opioid prescriptions per 100 people. So in the green states here, 52 to 63 out of 100 people are using opioids. So that's 50% of the population already is using opioids. But check it out. When we go into the yellows and the orange, 100% of the people in these states, wait a minute, these red states, 128 to 143 out of 100 people. It means every man, woman, and child in that state has more than one person. There's enough for more than one person prescription per person. Like, holy cow. That means people are on more than one prescription of more than one opioid at a time. Yeah, that's what that means. So, wow, that is just so concerning. And that was back in 2012, and the problem has continued. 40 people a day are dying from narcotic prescription overdose. It is a real problem. And this is in 2010, there was already enough prescription painkillers to medicate every American adult around the clock for a month that was being used on a daily basis. So the overdosing deaths involving opioids, cocaine, and heroin, you can see where the numbers are going here. And just recognize that, right around this time frame, when the cocaine use started to go down, the opioid use just kept going up. And then you can see right about here is where they were trying to cut back on people. So they were cutting them off. If they were on prescription opioids, they were starting to cut them off. And look what happened to the heroin use. It just came up to fill in the gap. Yeah. So it is such a problem. And, it's all over the news. It's no surprise. Everybody's heard about the problem. Well, I want to just go over one study that just came up recently that is mind-blowing to me. This was it was actually from 2024, March of 2024. So it just came out, and it was an outcome assessment where they were comparing people that were under care with physical therapy and people that were under care with chiropractic care that had low back pain, and that the amount of opioid use in these populations and the healthcare utilization. And what they found was that the group that was under chiropractic care actually reduced the opioid use by 55%. But the group that was under physical therapy care increased the use of opioids by 90%. Wow, what a study. So that ties in very nicely with the older study that found that the first person you go to is so important. But now it shows whoever you're going to ongoing, the chiropractic group is going to lower your risk of having to be relying on the opioids. So when we look at the other options here of what else is done, what are the common things that are done? So again, heat can feel good, but sometimes heat can actually increase inflammation. So anytime there's tissue damage, it means that there's an inflammatory problem. And heat, although it relaxes the muscles, it is a vasodilator, so it can actually increase chronic inflammation. And when you have a new injury, you actually want the body to have that inflammation, but you want it to have it in a healthy way so that it can have it peak to help with the healing and then resolve. And the use of the over-the-counter non-steroidal anti-inflammatories like we call them NSAIDs, the ibuprofen and the Motrin and those kinds of things, those actually can interfere with the resolution of the inflammation and can actually push people into a more chronic inflammatory state. Bed rest, again, the imbibition is so important, and the muscle atrophy is a problem. So it's a bad idea, an acute injury, 48 hours of rest, good, but you just need to get up and start moving after that. And otherwise, it's going to lead to degenerative changes in the discs over time. The drugs, again, they're there to cover up the symptoms. Remember that the pain is actually the body's way of signaling you, of warning you, of telling you to stop doing things that are going to be hurting you. And one study actually showed just for pain relief, just on its own, 58% of the people felt the drugs were effective, 54% felt chiropractic was effective, and 48% felt PT was effective. So they all were effective for the pain. But it's important to ask the other questions, which are, what are the side effects of the approach? So even if pain offered the similar relief that chiropractic care, even if drugs offered the similar relief to the pain as chiropractic care, the side effects of the drugs are way worse. So that's an important thing to look at as well. PT, physical therapy, it actually can be useful, of course. There's excellent PTs out there that are treating the soft tissues that are surrounding the problem, but make sure that you also are addressing what the cause of the problem is. So there's the structural, neurological, motor unit damage and derangement that needs to be addressed, not just the soft tissue. I find that PT that is focusing on recovery orientation and rehab orientation is going to be the most effective way of using the PT, rather than just trying to use it to deal with the pain. As far as pain management itself goes as an approach, at this point, people are just desperate. They're just not addressing the cause anymore. And if you look at the pain management approaches, you just have to look at what's the safety and efficacy of them and what's being used. The most conservative most conservative and at the very least equally effective and much safer than drugs and surgery is really what you want to be looking at. So asking the question, what is most cost effective? What has adverse outcomes or risks? And what about addiction issues? All right, and now we get to the topic of surgery. So by this time, getting into the realm of surgery, you're really desperate. And if you look at surgery and you look at the outcomes, it's incredibly expensive. It's potentially dangerous. And again, just going back to safety and efficacy, what does the research say? And is there a better way? So the research says that spinal fusion surgery is very limited when treating degenerative joint disease and low back pain. And yet it actually was increasing its popularity by over 200% from 1990 to 2001. So recently, it's actually come down, and I'm always happy to see that. But it is interesting that the higher the spine surgery rates are, the worse the outcomes are. And the best outcomes in the US were looking at communities where when the surgery rates were the lowest in an area, that was the best outcomes. The worst outcomes were where the surgery rates were the highest. And some of these new spinal fusion techniques that they use and the devices that they implant to deal with it, you have so much risk of nerve injury and blood loss and overall complications, the operation times, the repeat surgeries, and all of that does not necessarily even result in any improvements in disability or even in reoperation rates. And so, is surgery really the best option? It's an important question to ask. You can see what happens here. They pretty much rip open your spine and insert these, at times, these devices or this hardware that is put into your spine to fuse things together. You can see what it looks like. This is not just a cartoon drawing. This is really what the hardware looks like inside of when they're doing fusions of the spine. And of course, when they do a fusion of the spine, it means there's going to be so much more demand on the parts of the spine above and below the fusion that are used to sharing motion. But when you fuse those joints, they no longer are going to be sharing the motion. There's going to be so much demand that we see an increase in degenerative change in the joints on either side of those surgeries is what we see over time. What about chiropractic care? So the results are in the clinically and cost effectiveness. This was one study that actually just looked at Blue Cross Blue Shield of Illinois. They watched over 7 years. They had 70,000 member months that they were able to look at. And what they found is the people that were using chiropractic care compared to the people using allopathic or conventional medical care, they had a decrease of 60% in hospital admissions, so actually going into the hospital to stay, a decrease of 59% of hospital days, a 62% decrease in outpatient surgeries and procedures, and an 85% decrease in pharmaceutical costs. So that's pretty cool to see those kinds of results. And that's just one of many studies that show the effectiveness of chiropractic care with low back pain. So again, just, looking at the symptoms are the warning signs from your body, that your body is trying to communicate with you. It's begging you for mercy. It's begging you to make some changes. So really, how do you learn how to speak body and understand what your body is trying to communicate to you? What kinds of changes do you need to be making? Well, first, let's recognize that these body signals or body signals of any kind, they are the tip of the iceberg. So the symptoms are the part that is showing, but look at below, there's all kinds of things that could be going on that don't necessarily have symptoms, but are affecting function. And so the body signals are the tip of the iceberg, and it's the way that you think about symptoms is what's going to drive your choices. So if you start to think of the symptoms as a signal that your body's trying to communicate to you that you need to make a change, versus thinking of the pain as, oh, just something that needs to go away, and I'll do anything to just make it go away. Give me those drugs. I feel better now. I'm good, right? If you're thinking of the symptoms that way, it's going to direct you looking in different places for solutions. So thinking of the idea that your body is smart and it's trying to communicate with you, and you just need to ask the question, what do I need to change here so I can let my body get healthy again? That's going to lead you in the right direction. If we look at where symptoms play in this illness wellness continuum, let's just recognize that every one of us that's looking at this range, we all fall somewhere here. So on the far left, we have premature death. So you're getting sick and sicker and worse symptoms, and then you have disability, and then you have early death. On the other side, you have this high-level wellness, where you have robust levels of health. Now in the middle is a neutral point. So we have the sick zone on the left, we have the healthy zone on the right, and the middle is the not sick zone. It's the place where you may not have symptoms at this point, but you certainly don't have the range of robustness that you would have at high-level wellness. And that's important to recognize that, because so many people will say, I was just bending over to pick up my toothbrush, not realizing that they were not at high-level wellness the moment before. They were right on the border waiting for a symptom or a sign to start happening. So symptoms are there to tell us what direction we're headed. And if we don't pay attention to that and we just try to mask it, it means that we could be losing more and more function, going in the wrong direction that we want to go in, while we're not feeling it because we're using medications or drugs to hide or mask the symptoms. And we could be actually losing more and more function even as we're feeling better. So that's so important to recognize that. So remember that if we look at how all this works, many times people are relying on pain as their indicator of whether or not they're healthy. But you can see the symptoms of pain start to show up well down the level of function. When you're losing function, they don't show up until here, when you've already lost quite a bit of function. And if you don't actually address and correct what's going on, even as you're trying to manage things with painkillers, you could be moving towards disability. And disability is where you get to the point where we can't correct the symptoms anymore, and you have to actually just live with that disability. So I hope that helps to look at this as a range here and know how important it is to pay attention to when your body's talking to you, and recognize that you have to make changes if you want to get headed in the right direction. Sometimes when people come to see me, they've got a momentum. So remember that we're all somewhere on this continuum, but nobody's standing still. Everybody's moving in one direction or the other. And there can be a velocity and a momentum to that direction. So some people might be moving very strongly in this direction of losing function. And sometimes the first goal that I have, the first job I have, is just to slow down the momentum that they're going in the wrong direction before we can pause it and then turn the corner and start moving back in the right direction. So sometimes that's the first thing, is just slow down moving in the wrong direction. So we don't see that immediate improvement because we have to actually get some more stability into the system first. Remember that if you're thinking about feeling pain as an indicator, when we look at the entire nervous system, there are different parts of the nervous system. The sensory nerves are the part of the nervous system that feel pain. The other 90% of the nervous system is actually running the function. It's running the muscles and it's running the organs. And so the motor nerves are, if they get affected, you're going to see weakness and spasms, and you're going to see fatigue and tightness. When the autonomic nerves are being affected, you're going to have things like, trouble with sinuses or allergies or low energy or digestive problems or breathing problems, because it's affecting the organs. It also can affect the blood vessels, and that can actually interfere with your ability to heal an area. So even affecting the blood vessels going down into the legs or going into the low back. The sensory nerves are what feel things. And so the sensory nerves feel pain. They also can feel hot and cold and temperature. And they also have a sense of where your body is in space. So it actually is very important for posture to have clear sensory nerves, so the brain has a clear perception of where your body is in space. So if you are thinking that the pain is the thing that's going to show up if you are hurting your nerves, actually only 10% of the nerves actually sense pain. So you could have 90% of your nervous system being affected and not even feel pain. That's important, because we don't want to be relying on pain as our indicator. And then, of course, there are people that go through procedures where they have ablations to stop feeling the pain. So if you have an ablation, that means they're destroying the nerve So you no longer are feeling pain, but guess what else? You may not be sensing hot and cold. You may not be able to sense your posture and your body's position in space. That ablation could be affecting some of the other parts of the nerves as well. So very important to look at how are you assessing your level of health? Is it just based on how you feel, or are you going to assess it on what your actual function is? And there are ways that we can measure function. And so if you picture a nerve root coming out from the spine, it's a bundle of nerves that includes sensory, autonomic, and motor nerves all together in that nerve root. So when we look at that nerve root coming out, you can see it right here, this yellow part. That is a bundle of nerve fibers that includes sensory, motor, and autonomic nerves. And that nerve fiber is coming out from the spine, and it's going to all different parts of the body, and it's in charge of regulating different parts of the body. So you can see in this picture, it shows the different organs that these nerves go to. And it's kind of like a fuse box. So, if you blow a fuse, if you have an overload that is interfering with the proper flow of energy or electricity in a fuse box, right? You're going to have whatever room in the house that wire is in charge of, it's not going to be working, right? You can have misalignments in the spine that are then affecting how well the nerves are working, which are in charge of running certain parts of the body, whether it's organs or whether it's, down in the lumbar spine, you can see where these nerves go. They go to the large intestine, to the bladder, to the reproductive organs. And of course, those nerves come out and they go right down into the legs as well. So innervating the muscles of the low back, also innervating the muscles and the tissues in the legs and down into the feet. Now, right here in the bottom corner, we can see a scan. This is a surface EMG scan, and it is measuring what's happening in the nerves that are controlling the muscles along the spine. And anywhere we see color here, the red bars and the green and the blue, that's all signs of where there is a lot of tension, spasm, too much activity in those muscles. So we can literally measure that, because that's the part you can't feel. That's not a measurement of pain, it's a measurement of function. And literally we can measure the nerve supply to the muscles to see if they're on overload. And so when we have subluxations or misalignments of the vertebrae, I'm just going to back up for a minute here and just show you. Whenever we have these overloads, when you think of a fuse box or a circuit breaker, a fuse doesn't blow just randomly. The only way a circuit breaks is if there's an overload in the system. And the same thing can happen in the spine, where we get misaligned, we can get jarring of the spine, but we can also have poor posture, bad habits that can cause those misalignments to persist. And those misalignments are leading to overload, where the vertebrae are getting irritated. Now I want to just go back and I want to show, let me just see here if I have a picture of it coming up. Because we can have a stress response as well. So oftentimes when there's low back pain, we will have a stress response. Yeah, I'm going to get to that in a minute. So when there is a stress response, when you are experiencing stress from life happening, things that happen are the blood pressure goes up, the heart rate goes up, your muscle tone gets more tense, digestion gets upset and actually gets downregulated. Reproductive sex drive gets downregulated. Our serotonin levels are decreased. It's not a good time to go to sleep if you have to fight a tiger, if you're stressed out. Your sensory system goes on alert mode. So we have an increase in sensory systems. We have the increased levels of fear and anxiety. Watch out, be on guard. Our immune response actually will be down-regulated as well, because the immune system is such an expensive system to run that when we're in a stress mode, our body's just thinking about surviving the next minute. So it wants all the resources to go to just survive the next minute. Insulin sensitivity is going to be down-regulated, meaning we're going to have more blood sugar, more sugar in the blood, because that's the fuel that the body can use instantly if it does need to fight a tiger. We'll have a decrease in the HDLs and an increase in the LDLs. So those blood lipids they're gonna flip. And the reason for that is that if we are coping with stress, the hormones are made from cholesterol. They're made from these LDLs. And when we have a wound, we use the LDLs to repair the wound. For if you have a damage to the tissue, we have to actually use cholesterol to help repair that tissue. So that's why those go up when we're in stress mode, because we're anticipating that we might be encountering a tiger that might create wounds. And that's the same reason why clotting factors will go up. So this is an adaptive physiology that was really designed to save your life if you encountered a real life threat, which would be something like a tiger or something that was aggressively attacking you. However, in our modern life, we have stress responses that are actually showing up from just worrying about things or having a bad day. So that actually can affect our bodies, so that stress is one of the common causes of low back pain. So here's our premise. Healthy is normal. You need a better way to think about this. Healthy is normal. Your body is smart. Your nervous system is the master system that controls everything else. Your spine is the suit of armor that protects the nervous system. And modern life is unnaturally stressful. And it is so stressful, it comes at us in 3 dimensions. So it's not just our thoughts, our stressful thoughts, but it also is the chemical stresses that we're exposed to, and the physical stresses, not just from traumas of being jarred in your spine, slipping and falling in car accidents and sports injuries, but also sedentary lifestyle. So we have the macro stresses, the macro traumas of slips and falls and car accidents and so on. But then we have I'm just trying to take care of my yard. You know, we actually had snow today. Here we are in April, we had snow today. So this is the time, gardening season. Everybody's getting out into their gardens. And so you don't have to have a car accident to get subluxated. It can even be from doing things improperly in this way. But again, there is also the micro traumas. And so the micro traumas are when we are, the kids that are carrying the backpacks, or bending over improperly with the gardening, or use of devices and looking down all the time, or just poor posture if it's a student in school, right? Or if it's an adult, having to sit too often and too long and in improper postures. So all of these ways are the micro traumas that we have, and those pile up, those accumulate. And it's a bigger problem than those one-off events of injuries. Sitting is the new smoking, we say now. So really, sitting is such a problem. And now you understand the sitting is actually causing those discs to deteriorate more and more because we're not being active and moving them. So discs stay healthy from movement. So all of this stress, what does it lead to? It leads to subluxations. And so when we have subluxations, we have joint misalignment. That leads to soft tissue damage. That leads to inflammation where it starts to irritate the nerves. Then your smart body actually tries to spasm the joints because it wants to lock that joint down to try to minimize the irritation to the nerves. And when you have muscle spasms, those can be painful. But the muscle spasms are there trying to protect your nerves. When you have the muscle spasms, you lose the motion in the joint. Then you have a loss of imbibition in the disc, and you have a fixation of that joint. And when you have a fixation in the joint, that deficiency of movement, not only does it affect the discs and cause them to deteriorate over time, but the brain is relying on a certain degree of movement in the spine so it can actually locate where the body is in space. And so it takes these mechanoreceptors that are firing anytime we move, and that gives the brain a picture of where the body is in space. We call that proprioception. When we have joint fixation, we have a loss of proprioception. When the brain is no longer able to track very specifically what's happening in a joint, it goes into a stress response because it says that is abnormal, and it goes into a global stress response. So we have this toxic global physiology that is coming from a movement deficient syndrome that can come from, yes, from sedentary lifestyle, but from subluxation where the vertebrae have spasmed trying to protect the nerves. And so that's one of the components of a subluxation. And then remember that sometimes when you lock down those joints, you will have pain, but many times you can have the spasming and the subluxation and not have any pain at all. And so that's important because you need to actually have an evaluation to see if you've got any of those subluxations, rather than just thinking you're always going to have pain if you have them. So if you do have low back pain and it's caused by subluxations, and we need to start correcting those subluxations, there's certain things you're going to need to stop doing, certain things you're going to want to slow down on, and certain things you want to start doing. And that's how we correct and bulletproof the low back. We use a 3-legged stool model here in the office. So the first leg of the stool is the adjustments in a rhythm, adjusting the spine to get that correction back into the biomechanics of the spine. So we have the proper movement and alignment in the spine. We use an approach that will help people to break the bad habits that keep recreating the patterns. And then we use exercises to strengthen the spine. So when we look at the idea of the adjustments, we actually do want to have corrective care as part of the approach. So rather than thinking of the adjustments as a one-off thing that's going to reset that vertebra back into motion one time and you're going to be all fixed. Yes, I do have these miraculous changes where people, they have back pain, they get adjusted and the back pain goes away. But I want you to think about the adjustments as a corrective rhythm, because there's a momentum that happens when you're getting adjusted regularly. And the benefits are cumulative. So the healthier that your spine gets, whoops, let's go back. The healthier that your spine gets, the healthier it's going to be. The more degenerative or more unhealthy your spine gets, the more it's moving in the direction of getting more and more unhealthy. So as you get adjustments on a regular basis, they have a cumulative effect where you will get greater and greater benefit over time from the ongoing adjustments. And it actually helps to support a much stronger healing process. Some people, they'll come in and they may not be getting regular care and they have back pain and they come in, they get adjusted, and then they feel better and then they stop care. So when that happens, they actually are not using chiropractic to the best way that they could, because the corrective care is the part that's important. Remember, we talked about the importance of having good curves in the spine and good alignment in the spine. So that's the importance of the corrective care, to slow down and stop degenerative change, or to prevent that degenerative change from ever happening. So corrective care is really the most important thing to do for the spine. And that's what we call spinal hygiene. Having good spinal hygiene means getting checked regularly, having subluxations corrected if they're there, and then doing the things in your lifestyle that are breaking the bad habits and doing spinal exercises. So the adjustments in a rhythm, it actually resets our healing rhythm, and over time it builds momentum and it has that cumulative effect. It actually acts as a hormonal reboot as well, so it turns the stress switch off. So if you have the subluxations that are driving that high cortisol or stress hormones in the body, the adjustments turn that off and resets your hormones to a healthier level, to back to the feel-good hormones, the endorphins, the oxytocin for bonding, the anandamide, which is the bliss hormone. Sometimes people just feel in a blissed state when they leave from their adjustments, and that's because it literally resets the hormones in the body. And so some people, they may have flare-ups, but if they have regular care, they correct more easily. And if people are only getting adjusted when they flare up, it gets harder and harder to correct over time, because the degenerative change is continuing in between their visits because they're not getting the corrective care that they need. I want to just geek out a little bit here and go into a little bit more detail with what's happening in the muscles here. So when we look at the muscles of the spine, there are both the big, broad power muscles, but there are these tiny little muscles that are called the multifidus muscles. And these are the deeper layers into the spine here. And these little multifidus muscles, they don't do a lot of power work, but they do very specific, intricate work. And anytime that they are contracting or relaxing or moving, they are sending those crucial signals up to the brain to tell the brain where the body is in space. These multifidus muscles, they actually are not voluntary muscles, they're involuntary muscles, whereas the big erector spinae muscles are the voluntary muscles. So when you decide you want to move your body, you'll use the voluntary muscles, but the multifidus are involuntary. So they're just going to be responding to different things that happen in the environment. So when there's overload, it is the multifidus muscles that will start to spasm up and lock up that joint. And so when we're talking about giving people exercises to do, again, we go back to the three-legged stool, adjustments in a rhythm, breaking the bad habits, and doing the spinal exercises. What about those exercises? Which exercises should we be doing and when? Now, it really just depends on the different things that are going on with an individual on what exercises I'm going to recommend. So if they have an SI problem, there's certain exercises I'll recommend. If they have a disc problem, there'll be some other exercises. If they have a loss of the lumbar curve, it's a different exercise concern. If they have stenosis in the spine, where the degenerative change over time is making the hole smaller and smaller, the canal smaller and smaller, and putting more opportunity for stress on the nervous system. There's different things I would recommend. So for example, if somebody has a disc problem, there's something called the mini Mackenzie, where you lie on your belly and you have your elbows underneath your chest, and you can kind of create a little bit of a traction in the spine. If somebody has a sacroiliac concern, I like to have them do the windshield wiper exercise. So before they get weight bearing in the morning, they're going to lie on their back and turn their toes in and out, back and forth. And that pumps the sacroiliac joints, getting them ready for weight bearing. It's also a good thing to do just after laying down at night. Just do that a little bit, and it kind of decompresses the SI joints. Also, if there's an SI instability, I'm going to recommend a sacroiliac belt. And so that sacroiliac belt is a belt that's worn low around the hips, right across the sacroiliac joints. And it helps to support those joints so that they lock into a healthy position for that joint to move. Remember, that's one of the most complex joints in the body. So the SI belt actually helps to support healthy movement in the SI joints. And that allows the ligaments to heal up better. There's some other belts that I might recommend for people that are struggling with disc trouble or the facets being irritated. And then, of course, there's the back vitalizers that we use. So if you do have to be sitting and you have low back pain, it's rough. So if you have the back vitalizer underneath you, it's that little pillow that you blow up with air, and it keeps your spine moving. So it's going to help those discs be healthier. If you put that back vitalizer behind you, it helps to support that healthy lumbar curve that we want to see. So we have those here in the office for people to use to keep that lumbar spine healthy. Now, when we look at the spinal assessment, when we look at what exercises we're going to have people do, we start with a spinal assessment so we can understand exactly what is going on with that person. So let's look at that. What does a spinal assessment look like? Well, we're going to use instrumentation. We're going to use our scanning technology so we can look at the nerve supply to the muscles, the nerve supply to the organs. We can look at whether you're locked into stress mode and whether we need to actually address that and get you out of stress mode to help you get back into healing mode. So we use all of this, the different instrumentation to really get a complete look at what's happening in the nervous system. Not just the 10% of feeling pain, but the 90% that's running the function as well. We also will use motion palpation. If we feel the motion in the individual joints, we can identify which of the joints are locked up. Chances are that's where the subluxation is, because you've got that protective muscle spasm happening at that joint level. Even just static palpation of measuring where the vertebra is in space. Is it actually twisted off to the side? And then we actually look at posture, because posture is the window to the spine. So we can look at someone's posture, and we may see that their shoulders are tipped, or their hips are tipped, or there's some rotation in there, or they have that forward weight bearing where they're holding their head forward as they walk around, or they're thrusting their hips forward as they stand. So we'll look at the evaluation of the posture as well. And then the x-rays are really going to give us a great idea of not just finding the problem on humans with the x-rays, but specifically looking at the human biodynamics, like the biomechanics of the spine. How is that person moving their spine? And over time, is it resulting in degenerative change? The x-rays will show us if there is degenerative change, and that will be an indicator that that subluxation pattern has been there for a long time. And I have people come in where they have their first occasion of low back pain. We take an x-ray and we see degenerative change there that they didn't even know was there. And that just tells us that they actually have had subluxations there that were uncorrected for a while. So that's going to be a different expectation, a different prognosis of their care is if there's degenerative change that we do find. So the x-rays are important for that. And this all helps us to then determine how we're going to be adjusting people. And so if we go back to the 4 aspects, the spinal assessment helps us understand how we're going to adjust them, but it also helps us to understand what the problem is and then how we're going to help them to get stronger, what kinds of exercises we're going to give them. So when we are looking at doing exercise, it's important that we have a warm up and a cool down. And we want to actually look at flexibility as a very important part of this as well. So the flexibility is key because that's what's going to give you, you don't just want to have strong muscles, you want to have strong, flexible muscles. So somebody could work at building the strength and just getting very, very tight and rigid and have a very little range of motion. What we want is that flexibility. That's going to be the healthiest way to be working with your spine because the flexibility means you have greater adaptability. So when we talk about flexibility, we want to be thinking about squats as the best exercise for flexibility. Let's take a look at a healthy squat here. So here's a toddler. Now, toddlers, their head is the biggest, heaviest part of their body. And so if they don't squat properly, they're going to fall over. So if their head is too far back or too far forward, they're going to fall right over. And so they have to have good posture, good biomechanics when they're squatting. So let's look at what the features of a healthy squat are. So the noggin is going to be in a neutral position, just right over the shoulders. We're going to have a good, strong lumbar area here. We're going to drop the hips down so that there's a crease at the hips, and the hips are going to be below parallel to the floor, so below the knees. The weight is going to be on the heels, and we might even see you lifting the toes up to make sure that the weight is on the heels. The feet should be shoulder width apart. The knees should be tracking over the toes, but not in front of the toes, not beyond the toes, just over the toes. The torso should be upright and not hunched over. So these are the important things for a squat. And I do have some videos also on my website to how to do a healthy squat. So definitely check out those videos. And so the squat is so important. And if you think about it, Americans have all the chairs to sit in, but many, many cultures around the world, when they want to take a rest, they squat. And they're used to squatting their whole life. So we all, as toddlers, started out being able to squat. And the important thing is to try to maintain that ability to squat. And if you can't squat right now, I want you to just start thinking about whenever you're sitting down, that you slow down the rate that you sit down so that you are going very slowly, almost like you're starting to go into a squat, and you're going to build a lot more leg strength that way. And if you go slowly down, and then once you're sitting, if it's time to get up, if you go very slowly standing up, you're going to be working the legs so that you're going to build strength in the legs. You can also use a physio ball, one of those big round therapy balls that they have, and you can bounce on that. And that's a great way to keep the discs moving, keep them supple, and then just do a very slow squat down onto the ball and a very slow rising up off of it. And over time, you can get into a lower and lower squat so that you can actually get down into that place where your tailbone's down lower to the ground. So it is worth it to put time into doing squats. If you're having trouble with your knees or you just feel like your balance is off, then again, just use the technique and the approach of being able to just squat down to a chair and then come up out of that chair slowly. Okay, now let's get back into looking at core strengthening. So there's a level 1 of core strengthening and a level 2 of core strengthening. So for the level 1 of core strengthening, doing things like in your standing posture, doing the inner corset exercise. Esther Gokal is the one that I learned from about the proper standing posture. And so again, I have the videos on the inner corset that I've given to you if you're patients in the office. And if you're not, please contact us and let's check you out and see if we can help. So the inner corset is where you're standing, you're lifting the tailbone up and back, and you're feeling the weight driving into the heels. That's where you know that you're doing the inner corset properly. And then at the same time, you're going to just tighten very slightly the ribs towards the pelvis. And so you've got a tight corset all the way around with the tailbone lifted and the ribs tightening down. So that's the inner corset. The foundation training is Dr. Eric Goodman's work. And he was just tremendous in coming up with very short little exercises, 3 minutes long, 4 minutes long, which involves how to hinge at the hips. It's really training you on how to bend properly, but at the same time, it is adding strength and flexibility to the whole posterior kinetic chain from the back of your head right down to the back of your heels. And that's truly the best way to bulletproof the spine, is have your adjustments that are correcting the biomechanics and then doing these exercises for core strengthening. The sacroiliac exercises are going to involve things like doing stretches to the side on either side so that you are gently doing a rotational on your back, legs dropping off to one side and then dropping off to the other side. And all of that helps to stretch the piriformis out and the muscles around the sacroiliac area. So you start with that level. The second level of the sacroiliac exercises is doing lunges, where you put that one leg back behind you. And you can even do it sitting in a chair with your one leg on the side and just stretching your leg back behind you. That can really stretch the psoas muscle in the front of the abdomen. That's key. So that's really good for the sacroiliac on either side. You can also lay on your back on the edge of your bed and drop your leg off of the edge of the bed, is another way to stretch that sacroiliac, stretch the psoas muscle. Doing a plank is actually an excellent way to build core. It's one of the healthiest ways to build core. So doing a plank is where you are, if you're lying on the floor on your belly, it's where you just do like a push-up, and then you're just holding yourself in that push-up with either with your knees, with the weight on your knees and your hands, or straightening the legs and having the weight on the toes, as though you're doing a suspended push-up. You can also be on your elbows if you have any trouble with the wrists, or you can be on your fists in that plank. And the goal is to be able to do a 2-minute plank. That would be the goal. And that's actually a sign of longevity. So people that can do 2-minute planks, it's one of the things to be testing to get a sense of the longevity of that person. So those first 4 are the core level 1. And then if you want to get more advanced, core level 2, if you're already able to do all of these things, then you can do things like a plank on the move. So what that means is, instead of just doing the stationary or still plank with your hands both there, you might start that way and then lift one hand up and head it towards the ceiling as you're balancing on one hand, and then do the same thing on the other side. So that's a way to do a plank on the move. You can also do a plank with your elbows on a physio ball. So that requires a lot of core and movement. And you can even get balanced on that ball, and then you can even try to make some patterns or design, like do a figure 8 or do an alphabet where you're tracing the letters with your motions. That's a great way to get another whole level of core. You can also participate in groups and trainings like CrossFit and Pilates and yoga as that second level of core strengthening. So again, using the physio ball is a great way to start with core strengthening, just going very slowly down onto the ball to do as if you're doing a squat, and then coming up very slowly. You can even just start at that level. And then you can also turn around and do your plank on the move on that physio ball as well, as another way of doing core strengthening. So that is the idea, is to do the adjustments in a rhythm, do the spinal exercises to strengthen the spine, and then breaking the bad habits. And the bad habits are all about how you eat, how you move, and how you think. And so if you want to have a bonfire, you need 3 things: fuel, air, and spark. If you're missing any one of those things, you have no fire. And so if you're thinking about health, you have to address all three. Some people, they think, oh, my diet's really good. I don't really need to exercise too much. My diet's so great. Or other people like, I'm so fit because I work out all the time, so I can eat whatever I want. And it's not true. It's going to come back to bite you in the end. You have to be addressing all three at the same time. So when you think about how you eat, anti-inflammatory diet is the best way to go there. Just trying to progress, not perfection, just to replace any inflammatory foods with anti-inflammatory versions of other healthier foods. And we have the anti-inflammatory handout if you need that. When we think of air, it's how you move. So not just moving your body, getting up, not being sedentary, but also moving properly, moving in a healthy way. And so training you on the healthiest ways to be moving your body. But getting panting and sweating exercise in on a regular basis is really what we mean when we say moving your body. Like going for the same walk that you've done for years, where your body is so efficient at it that you don't even break a sweat, you don't even pant, then you want to actually change that up, and you want to push yourself more so that you're getting the panting, sweating, burst exertion exercise in. And then spark. Spark is how you think. And so when we think about thinking, if you're stressed about what you're thinking about, then you want to do things to change that. So for some people, prayer, meditation, being out in nature, in the quiet, are good things. There's a technique called EFT, Emotional Freedom Technique, which is tapping on the endpoints of acupuncture meridians, helps to turn the stress switch off in 30 seconds. So those are the kinds of techniques we want to use to make sure that we are having healthy thoughts that are not going to interfere with the progress that we're looking for. And so that's it. How you eat, how you think, how you move, that's breaking those bad habits. It takes a little bit more to break a bad habit. We know that. But again, it's progress, not perfection, just moving in the right direction every day, just moving in the right direction. And that's how we get the results that we get. Adjustments in a rhythm, breaking the bad habits, and doing the exercises to strengthen the spine. So that is everything I wanted to cover with you tonight. And so I hope that it was useful for you. I'm going to stop the screen share. I'm going to stop the recording. And I want to just keep it open for questions if I can help you. If you're watching this recording and you're curious on whether we can help you, please feel free to reach out to us. You can send us a text at our office number, 802-985-9850. That's 802-985-9850. Just send us a text and let us know you saw the presentation and that you want to sit down and have a chat. And we're happy to set up a consultation with you to see if we can help. All right. Thank you so much, everybody.